Bismillah ar-Rahman ar-Rahim. Hi everyone. As you all know, the ACGME really recommend that all internal medicine resident program train their residents on scholarly work, including doing research and also learning about evidence-based medicine and how to read a paper and abstract the important information from the all the evidence that presented in literature. So journal club is just one activity that I believe most, if not all, programs do. So I thought to give a quick and short videos of what I think it's kind of a good way of presenting a journal club to make it engaging, to make it interesting, and also to make sure that the residents are getting the benefit that they're supposed to get from such interesting activity and important activity. So what I'm gonna do is it's gonna be around 4 videos, very short videos. I'm just gonna talk about the 5 common titles that usually most of papers are presented with, the format that you usually see in, for example, randomized controlled trials that are published in most of the medical journals. We're going to talk about the title and the introduction. We're going to talk about the methods, and we're going to talk about the results and discussions and conclusions, and how you discuss these topics with your audience, and give you some tips about how to do it in a nice way. And I will do that by giving an example of a recent article that I actually presented to my residents as an example of a way to do the journal club. So let's start. So, of course, the first and one of the most important steps is to carefully pick up the nice article that you want to present, right? So make sure that the article has some practical implications. It would be nice if you can present something that you think might change the practice or is actually affecting the current practice, whether that be inpatient or outpatient. Also, if it has teaching value, if there is specific terms that are used in that article and you want to teach the audience about it, that would be nice. Or any important information or terms that are commonly used in research and literature, and you want to make sure that your audience are aware of it. That would be cool too. Most of the time, people will present randomized controlled trial. That's kind of the standard of care, so to speak, in literature and research and evidence-based medicine. But definitely, you can present any paper that you think are has practical implications and has teaching values, like we talked before. But randomized controlled trial are kind of the typical ones. And then make sure that it's a recent article, but of course any old or landmark paper that really greatly affected our practice or make some changes in the way we do medicine is also very valid. But of course, recent ones is the one that maybe your audience will be more interested to listen to. So I suggest that you start with a case relevant to the topic or the study that you're presenting. So for example, here, that article I discussed with my resident was about a GLP-1 receptor agonist, tirzepatide, and it's used in heart failure with preserved ejection fraction in obese patients. So I just created this vignette and I put the question in here, and just to kind of steer the discussion. We're going to use this question at the end of the topic as well. So I was just interested to know the answer before and after presenting the article and see if there's any difference or how people think about such a common presentation of heart failure. How do they think about the management and whether this article really made any difference in the way they're thinking about the medications upon discharge for a patient admitted with heart failure. So think about a case or any question actually that you can start with that has clinical implications. I think that would be nice. I also suggest that to make it engaging, to use apps like Poll Everywhere. I really like it. I love it. The basic form is actually free. and the audience can use their cell phones to kind of answer the question, or use the app to answer the question. So to make it more engaging, and it could be anonymous, I think most people will participate. They can just put their answers in there, and it will really make it more interesting. And then you can do it again, as I said, by the end of the presentation, and ask the question to the audience again. So I personally believe that, as someone who reads medical literature, it would be nice if you can think of yourself as someone who is reviewing the paper for the journal. So the journal send you an email, hey, this researcher, they want to publish this paper, and they have these findings, and this is a manuscript. What do you think? Did they do everything right? Is everything is okay? Do you think it's interesting? Do you think the results are valid? So and so. Of course, that doesn't mean like you have to be like, a statistician or epidemiologist, but at least to have like a basic knowledge about these things and these terms, so that you can, appraise the paper and get the most out of it. So think of yourself as really kind of a peer reviewer for the journal, and look at the article from that perspective. I think that can help you really examine the paper in a better way. After that, I suggest that you start with discussing the title. The first thing in any paper is the title. So, for example, ask what do the authors claim they will demonstrate in the paper. That's basically the research question. Do you think the title is really informative, and it tells what the paper is going to talk about? So, for example, the article that I picked up to present, the title was tirzepatide for heart failure with preserved ejection fraction and obesity. So obviously we know what this paper is going to talk about. But I asked them, do you think that does it have all the information that you need? Do you think it's informative? So for example, here I don't know exactly what the article is going to talk about. Is it a trial? Is it a retrospective trial? Is it a review article? It's not very clear. But it seems like it has all the important terms, so that if someone want to search literature, for example, they're looking into possible medications that can be used for heart failure with preserved ejection fraction in obese patients, the title has really all the terms that they need, to improve the search. So that's good. So yeah, discuss the title and see what people think about the title, and how we're gonna go talk about the title also at the end of the article, and see if people have different opinion about the title, and whether they have actually other suggestions for a better title. Okay, so for the introduction, you can ask about the research question. For example, you can just tell them exactly what the article mentioned in the introduction, and what the background information that they provided. So, for example, in this article, it was about obesity. They said that obesity increases the risk of heart failure with preserved ejection fraction. They said tirzepatide causes considerable weight loss, but data are lacking with respect to its effect on cardiovascular outcomes. So, from that sentence, you can ask them, so what do you think is the research question? What exactly the research want to discuss? And then from there you can ask them, for example, so what do you think is the primary lineal hypothesis, for this research question? So basically, in this case, it's there's no difference between tirzepatide and placebo in improving the cardiovascular outcomes in obese patients with heart failure with preserved ejection fraction, right? So here you brought up some term that you commonly use, in research and statistics, which is the null hypothesis. So you can have a discussion about that if you want. And then you ask them, how would you design the study based on this research question, right? So this is another area for discussion, and then you can have different opinions about people saying, hey, you know what, I think, as usual, RCT may be the best way to do it. Others will say maybe you can start with a retrospective study first and get some basic information, and then after that you do the RCT. So it just help really kind of incite some discussion about again some other statistical and epidemiological terms. In the introduction as well, you can bring up a couple of questions that are relevant to what the background that they mentioned in the introduction, to kind of stir the discussion again, and also just make sure that your audience are aware of important information that they need to know, before going into the details of the article. So, for example, in this case, I asked what are the FDA-approved indications for tirzepatide, and I asked what are the FDA-approved medications for heart failure or preserved ejection fraction. And of course, you can use applications like Poll Everywhere to have the audience be engaged in the discussion, or you can just use a show of hands for that purpose, or whatever you think is appropriate, and depending on the time that you have available. So that's about the introduction, and next we're going to talk about the methods.